Now we are going to talk about exercise and why it is important. Research tells us that exercise is one of the most helpful ways to improve cancer-related fatigue. Studies have shown that exercise can lower levels of fatigue by 40 to 50%. Exercise can improve survival and lower the relative risk of some cancer recurrence. Many other benefits of exercise include improved sleep, memory and attention, quality of life, cardiorespiratory fitness and physical functioning, and weight management. It also is generally good for our body, for heart health, building muscles, and exercise also produces feel-good hormones called endorphins, so it can help improve your mood. There are also some studies that show exercise through cancer treatment can help you to reduce the number of side effects you get from treatment, how bad the side effects are, and make it more likely that you will be able to complete your cancer treatment, such as chemotherapy. It can reduce the chance that you will need to stay overnight in the hospital and your overall quality of life. Try to remain active as much as you can during chemotherapy and radiation therapy and following cancer treatment. It may be hard during active treatment or if you are not doing so well, but if you can do a little, it will help. Even 10 minutes of walking can help. In terms of when to exercise, the answer is really any time. However, it is important to listen to your body. You want to start where your body is at. Honoring where you are and building up gradually allows your body to adapt and adjust safely, as opposed to diving right back fully into the routine you had before your treatment started. You may be at risk of injury if you go too fast. Some people may need to have a specific exercise program developed for them by a physiotherapist. It is especially true if you are very weak or have other medical conditions such as arthritis, bone metastases, and heart problems like coronary artery disease or chronic heart failure. There are different types of exercise that can also help to restore your energy, such as strength training, aerobics, or flexibility. Each one has its own benefits. Generally, the physical activity guideline for adults is to aim for at least 150 minutes of moderate to high intensity aerobic physical activity per week. This guideline is for after cancer treatment and may not be the right fit for you during treatment. Even smaller amounts of activity and exercise for 10 minutes is still helpful. You can break 30 minutes into 3 10-minute sections and it still counts in overall exercise. You don't have to do it all at one time for it to count. On top of the 150 minutes of physical activity you do every week, it is good for your health to add in some muscle strengthening for your bone health twice a week. That also can help prevent falls or help you improve your balance overall. When it comes to strengthening exercises, what you can work towards is starting off slowly using your own body weight, followed by free weights or TheraBands. The key is to start off slowly and build up gradually. You may want to spread out the strengthening exercise 1 to 3 days a week with rest days in between as needed. Do 1 set of repetitions. 1 set can be 4 to 8 repetitions to start and work your way to 6 to 12 repetitions. Once you are comfortable with 1 set of repetitions, move up to 2 sets, then 3 sets at the same weight. Increase the sets of repetitions before increasing the weight to allow your body to get used to the weight. When you first start out doing strength training with cancer-related fatigue, you can expect to be working at about 50% of the maximum weight you can usually lift. Remember, it's important to listen to your body. There are many ways and many forms of exercise that can help you improve your endurance and conditioning. If you enjoy swimming, cycling, dancing, they are all great in terms of increasing your heart rate. What is key is to pick something you enjoy so it doesn't feel like you are exercising or working hard. If you are enjoying it and you get meaning from it, then you are more likely to continue it. Again, start slowly at 10 or 15 minutes and work up to 20 to 30 minutes. Slowly increase your exercise time towards the 150-minute goal for a week. Flexibility exercises are also important because they help break down scar tissue from surgery or effects from radiation. It allows more ease of movement, and it also helps you to feel that you are able to stretch your arms with less pain or tightness. It can also help to improve lymph fluid flow and reduce risk of swelling. Examples of flexibility exercises are gentle stretching exercise that you may have done after surgery. You can restart some of those if you feel that you are tight when you move your arm or your legs. Gentle yoga, tai chi, and qigong are other forms of gentle stretching exercise. Think of how you can increase your level of physical activity by doing simple things like getting off your bus stop earlier, one stop, or one subway stop earlier, and increasing the distance that you walk. Park a little further and walk a longer distance, or ride your bike to get around. If you have a stationary bike in front of your TV or any other exercise equipment, use it while watching TV. Walking stairs is usually more of a challenge, so save it for later when you are feeling more energetic. Sometimes exercising with others or in a group may be more motivating than doing it alone. Having a buddy to go for a walk can be supportive and encouraging. Find out what works best to motivate you to exercise and what supports you to keep at it. Sometimes a simple way to track your exercise is wearing a pedometer or using your smartphone apps to track how far you have walked or your heart rate. Having some sort of tracking is better because you can keep track of how far you've gone in 1 week. Then you can work at slowly increasing your total each week. Be sure to take breaks during your day to also stretch and pace yourself with your activities.